I hope it's working. Good morning, everybody. I hope that you are not so tired because yesterday was a tough day. And today I would like to talk about hyperextension overuse injury in handball goalkeeper. I would like to talk a little bit story. 30 years ago, when I was a young orthopedic surgeon, they proposed me to do the book about most frequent injury in the handball and their treatment. And I start to interview my friends, and I find myself in situation to discuss a bit about, I have that possibility to talk with 10 best goalkeepers in the world in that period. And I ask him, what is the most frequent injury that you're suffering and so on? And I think about ankle, maybe knee or shoulder. They told me all 10 elbow. In that time, my knowledge wasn't so big about elbow because we didn't talk about elbow so much in that period. And they explained me the ball hit us in the forearm, and after we have anterior elbow pain. And in my book in Serbian language, I describe it as hyperextension injury of the elbow as the most frequent injury in goalkeeper. And after years, when I decided to do my big study that you shared with me yesterday, I will continue today this part 2. What is goalkeeper in handball? They are defensive player, and their function is saving a goal. How they doing that? In handball, they develop specific technique of playing who is different comparing with the goalkeeper in soccer. That's like a little bit in ice hockey. They go a few 1 meters outside of the goal, and they try to, with a very fast movement of their arms, to block the ball. And most often this ball is hitting them in the forearm. When you analyze the position, most frequently that shoulder is between 30 and 19 degree of abduction, and elbow is at 30 degree of flexion. That is a part of that ligament is participating especially in the stability of the elbow. After, if you analyze the force of impact, as you know that most of these handball players, the speed of the ball is between 100 and 130 kilometers per hour, and the ball the weight is nearly 500 grams. That's tremendous impact on the forearm. And in this study, less important for you in this moment, but according on that study of 550 goalkeepers, most often they complain of the pain in the bilateral elbow. Almost all of these goalkeepers sustain their elbow injury from hyperextension trauma when blocking shoot, as you see. I ask my question, is it possible to mimic this clinical injury on cadaveric study if we know that the ball is 500 grams, that the impact is about 130 kilometers, and that means impact load similar to those sustained in goalkeepers. And for that study, we utilized 5 cadavers. We put it, we fix it upper arm. The elbow was mobile, and we drop the water bag, and helping with some mathematical analysis. If you take the weight of 1.5 meter, weight the water 1.5 kilos, and drop from height of 1.5 meters, you have this moment of force induced, and that's corresponding to the velocity of the ball of 35 kilometers. And there is 100 when you drop it from 3 meters, that's a little bit corresponding to velocity of 130 kilometers. And after we have done dissection of these cadaveric specimens, and what we find, in all elbow we find total rupture of the anterior capsule. What we find also, elongation or partial rupture of anterior band of medial collateral ligament. We find in all case rupture of insertion of flexor lateral muscle group, collateral ligament, sometimes partially partially ruptured, and sometimes lesion of the cartilage in the posterior compartment. And what conclusion we find? All they had L-shaped rupture of platoflexor origin, complete rupture of anterior capsule, elongation of anterior bundle of medial collateral ligament, and occasionally lesion of lateral collateral ligament complex with fragmentation of the cartilage near the posterior edge of the olecranon. All that, once we try to translate it in the same way as for the field player, we have done X-ray, telos X-ray, standard X-ray. We analyze it. We have done measure laxity with the help of a telos stress device, and we have done ultrasound, and we analyzed the results. We took 30 high-level goalkeepers with mean age nearly 27 years. What that means, 15 years of practice, and one control group of 30 volunteers. What interesting things about this chronic pain, complained 25 goalkeepers. That pain was intermittent in 70 and constant in 8 cases. There was decrease of extension and flexion in these goalkeepers, but there was no difference between left and right arm. Also, we find formation, osteophyte formation on the olecranon in 67%, loose body in 5% of case. And we have done this testing with the telos stress device before applying the force and after applying the force of 15 deca-Newton. And we find opening in 2 elbow, but there was no significant difference between left and right elbow. When you see analyze of the ultrasound of the thickness of the insertion of flexor pronator group from thickness of the medial collateral ligament, you are going to, we have find that there is, comparing with control group, there was a significant difference, but there was no difference between left and right elbow. What was our observation? The thickening of the medial collateral ligament was in 50% of case. Thickening of the triceps tendon was in 11 case. A thickening of the ulnar nerve was in 22 case. But there was no difference in dominance. Also, we find in 66% of case elbow effusion. At the lateral side in 45 and the anterior side 39. Loose body was present on the 1/3 of case. As I told you, there was no difference between dominant and non-dominant elbow. On the base of this study of different pathology, the different pathology was confirmed by imaging due to this hyperextension mechanism. And on the base of our study, we can say that the pathomechanics of hyperextension trauma, similar to handball goalkeepers, was confirmed on cadaver study. What was finding? L-shaped rupture of the flexor-pronator origin, total rupture of anterior capsule in all cases, elongation of medial collateral ligament, and occasionally small fragments of the cartilage in posterior compartment. Based on this finding, in our imaging study, we confirmed overuse of the elbow in these athletes is responsible for pathological changes in these 30 goalkeepers. We can talk about now of existent or specific injury pattern in these players. Thank you very much.